Chapter 7, Granulocytes and Monocytes. As we discussed in previous chapters, leukocyte precursors must commit to a cell line, differentiate, and proliferate inside the bone marrow except for T lymphocytes. These mature leukocytes are released into the peripheral blood where they circulate briefly, then move into the tissues where they respond to stimulus. The way in which mature white blood cells fight infection is by either engulfing the foreign invader, and those are done by granulocytes and monocytes, or they can develop an adaptive immune response, such as monocytes and lymphocytes. All of these cells develop from the pluripotent hemopoietic stem cell due to stimulation from specific growth factors. The stem cells proliferate and differentiate into the various types of cells you see, either granulocytes, which are neutrophils, eosinophils, and basophils, monocytes, and lymphocytes, as well as platelets. The concentration of white cells is affected by specific things such as age, so birth, white blood cell count is higher, and other physiological events such as activity level, time of day, and pregnancy. And in addition, certain things affect the white cell count, such as pathologic events, infections, immune-regulated responses, or quantitative and qualitative disorders affecting those cells. In order to understand each of those individual cells compared to the total white count, a calculation of the absolute white count is necessary. This includes the need to differentiate the percentage of each type based on the total white cell count. And this is done through calculating the total white cell count by the decimal percent of each individual cell line. Specific cell markers are used to identify each of the cells, and they're very specific in identification of the maturation and stage of the cell activation. Neutrophils are the most abundant white blood cells in the adult peripheral blood. They take up about 40 to 80% of the total white count, which results in an absolute count of 1.8 to 7 times 10 to the 9 per liter. At birth, this percent is about 50 to 60%, but after these infants start to develop an immunity, this drops to 30% as the increase in lymphocytes go up. By the age of 6 years old, this is where that 40 to 80% ratio comes into play. These cells develop from the hematopoietic stem cell in the bone marrow. They commit to a common myeloid progenitor, which gives rise to the granulocytes and monocyte lineages. Now, maturation begins upon certain stimuli by specific cytokines. Their lifespan is spent in 3 different compartments. First of all, the bone marrow is where they differentiate, proliferate, and mature. Then they move into the peripheral blood for a few hours and circulate there. And then they go into tissues where they perform their functions of host defense. There are 6 stages of identifiable maturation in a neutrophil: the myeloblast, promyelocyte, myelocyte, metamyelocyte, band, and segmented neutrophil, or polymorphonuclear neutrophil. Now, the first 3 stages of the myelocytes are hard to identify or distinguish between a neutrophil, eosinophil, and basophil. The first stage of neutrophil maturation is a myeloblast. It is the earliest recognizable precursor Its size is 14 to 20 microns in diameter, and it has a very high nuclear to cytoplasm ratio. The nucleus is round or oval and very delicate or lacy. It has 1 to 5 nucleoli that are visible within its nucleus. Its cytoplasm is small, and it has a blue agranular cytoplasm with a distinct unstained area adjacent to the nucleus, which resembles the Golgi apparatus. The promyelocyte is the next stage in maturation. It's 15 to 21 microns in size, and it has a very large high to nuclear cytoplasm ratio. The chromatin is coarser than the blast, but it's still open and lacy, and here you may see several nucleoli as well. Within the cytoplasm, you start to see these basophilic, prominent reddish-purple primary granules or non-specific eosinophilic granules. These granules contain peroxidase and beginning of antimicrobial compounds. The myelocyte is the next stage in maturation. It's about 12 to 18 microns in size. The nucleus is now reduced due to the condensation of the nuclear chromatin. The nucleoli is usually indistinct, and you will not be able to see it here, but it's round and oval and slightly flattened on one side. You have a clear light area next to the nucleus, and that is where the Golgi apparatus sits. Now at this stage, it goes through 2 or 3 cell divisions, and it's the last stage capable of mitosis. An earlier myelocyte is more basophilic in the cytoplasm than a later myelocyte, where you start to see the maturation of the cytoplasm that's turning to a pinkish color. At this stage, you're also beginning to see those specific secondary granules. Those big primary granules start to go away, and you have the synthesis of peroxidase positive primary granules stop, where it switches to peroxidase negative secondary granules. These specific granules appear in the dawn of neutrophilia or first by the Golgi apparatus. They are very small, sand-like granules with a pinkish red to pinkish lavender hue, surrounded by a phospholipid membrane, and the primary granules at this stage may be present, but it decreases as the cell matures. Here is an image of the neutrophil in various stages of maturation, where in A you can see that the image is a myelocyte, and in B you can see a higher nucleus to cytoplasm ratio and those large primary granules from the promyelocyte. A metamyelocyte is the next stage in development, where the size is 10 to 18 microns. The nucleus and the chromatin is very coarse and clumped here. The nucleoli is not visible, and you start to see an indentation within the nucleus, and it resembles a kidney bean shaped. The cytoplasm has a neutral pink color, and now the predominance of secondary and secretory granules are present. You also have tertiary granules synthesized during this stage and the following stage. A band neutrophil is 9 to 15 microns in size. The indentation of the nucleus is more than half the diameter of the hypothetical round-shaped nucleus. You have an increased chromatin condensation at either end. The cytoplasm is now pink to tan, and all the granules are present here. This is usually the first stage found within the bone marrow. And you see the uniform nucleus in a C-shaped, usually in the band. The segmented neutrophil is again 9 to 15 microns in size. The nucleus has segmentations of 2 to 5 lobes connected by a thin filament, and it's very condensed. Now, the standards for differentiating between a mature neutrophil and a band neutrophil, you can see that as soon as it starts to pinch in to form the lobes, we are going more mature. The cytoplasm is pink to tan or clear and contains many secondary granules, tertiary granules, secretory vesicles as well. Now, the primary granules can be present, but they're not evident due to the stain quality. The granules contain lipids, carbohydrates, and proteins. Now, here is a very good image to help you identify the neutrophil development. Compare the chromatin pattern of the nucleus and the cytoplasmic changes seen in the various stages. So from a very left image, you see an early band, then next to it is a myelocyte, above it is a promyelocyte, then next to it you see the large myeloblast with nuclei within its center. Above it you start to see more bands and a neutrophil. Please use this table 7.1 as characteristics of maturation within the neutrophil. It gives you the name of the maturation stage, in addition to the characteristics of the nucleus and cytoplasm, with the ratio of the nucleus to cytoplasm, what types of granules are present, and we will get into those CD markers more in hematology too. And here again is the later maturing stages where you can see the differences between the metamyelocyte, the band, and the segmented neutrophil. So now let's discuss a little bit of terminology. When we say neutropenia, this refers to a decrease in the number of neutrophils only. This is usually seen on the CBC report of an absolute count less than 1.8 times 10 to the 9 per liter. When we talk about the term neutrophilia, we're talking about an increase in the neutrophil cell lines. This relates on the CBC report to greater than 7 times 10 to the 9 per liter. Now, neutrophilia usually occurs due to a reactive response due to a bacterial infection, metabolic intoxication, drug intoxication, or tissue death. When we hear the term agranulocytosis, this is an absence of granulocytes, and this leads to a very high risk of developing infection because those cells are not available to fight off any foreign invaders. Now, the way the neutrophils function, they have 4 steps in the way they provide innate immune responses. First, they adhere to the foreign invader and they're activated by cytokines. Next, they migrate into tissues using chemotaxis. Then they would phagocytize such bacterium, and then they would use their granules to kill the bacteria. Eosinophils are also under the granulocyte umbrella and compose about 0 to 5% of the total white cell count, leading to 0.4 times 10 to the 9 per liter absolute count. When we talk about the morphological maturation, they have the same 6 stages as the neutrophil. The first recognizable stage is the eosinophilic myelocyte. So first you have the myelocyte and the promyelocyte. Those will not be distinguishable between either the neutrophil, eosinophil, or basophil. So on the left, you have the first recognizable stage called the eosinophilic myelocyte. They have the same classification and characteristics as the myelocyte listed in the neutrophil. The image in the middle is an eosinophilic metamyelocyte, where you see the kidney being shaped in the indentation of the nucleus, again using the similar characteristics of the nucleus to cytoplasm. The only addition is those bright orange, Leyden-filled granules. And the last is the eosinophilic band. Within the eosinophilic myelocyte, you're seeing large eosin-staining crystalloid granules. They're reddish-orange, spherical, and larger than the neutrophil granules. They are uniform in size and evenly distributed. Within the bone marrow, they mature and are stored, and that takes about 9 days. Mature eosinophils are about 12 to 15 microns in size, and the nucleus does not lobe usually past 3. So in a normal eosinophil, you see 2 to 3 lobes. The cytoplasm is completely filled with granules, and there are 3 types. First, the primary granules contain Charlotte-Leyden proteins with lysophospholipase activity. The small granules are not well characterized, and they contain acid phosphatase and aryl sulfatase. These specific granules are the primary source of cytotoxic and pro-inflammatory proteins. They contain those pro-inflammatory cytokines. Their function is an antigen presentation, adhesion to vessel walls, transmigration into tissue to do their function. The concentration of mature eosinophils in the peripheral blood is up to 0.4 times 10 to the 9 per liter. If you have an increase in that number, this term is called eosinophilia. It's influenced by the cellular arm of the adaptive immune system, or T cells. They provide pro-inflammatory cells that are associated with allergic diseases, parasitic infections, and chronic inflammation. Their major role is host defense against helminth parasites. They are also capable of phagocytizing bacteria, but not well. They also present antigen-presenting cells. They can liberate substances that neutralize mast cells and basophils when they respond to an allergic response. Basophils take up 0 to 1% of our total white cell count, and up to 0.2 times 10 to the 9 per liter as an absolute count. Absolute basophilia, or an increase in basophils, can indicate the presence of malignancy or cancer. Now, because the reference range is so low, you may not observe any eosinophils or basophils on a 100 cell differential. The maturation process is similar to the neutrophil maturation, where you start to see the gradual indentation and segmentation of the nucleus. Now, basophils' first stage that is recognizable is the myelocyte. Now here you start to see those large purple-black granules, which are unevenly distributed throughout the cytoplasm. You start to see the metachromatic granules that contain histamine, heparin, and the major basic proteins. On the right side, you see a basophilic band. And on the left, you see the indentation of a basophilic metamyelocyte. Mature basophils are 10 to 15 microns in size, and they have a segmented nucleus. They have many dark purple granules obscuring both the background and the cytoplasm of the nucleus. Their granules contain peroxidase and are water soluble, so they can dissolve on the right stained. You might see some clear areas as well within the cytoplasm. And you see here they have very large purple-black granules. Now, mast cells are within or known to function similarly to basophils, but in tissue. They are not found in the peripheral blood. They have a high proliferative potential and can live for several weeks to months inside tissues. Now here, when you're looking at these cells, the nucleus is round and surrounded by a dense population of granules. And the granules contain acid phosphatase, protease, and alkaline phosphatase. These mast cells and basophils are very distinct and terminally differentiated cells. Monocytes arrive from the common myeloid progenitor again and take up about 2 to 10% of the total white cell count, or 0.1 to 0.8 times 10 to the 9 per liter as the absolute count. They function more similarly to granulocytes than lymphocytes. They are produced in the bone marrow from that common granulocyte monocyte progenitor. And it depends on specific cytokines to differentiate it into a monocyte. Now, the monocytes in peripheral blood and macrophages in the tissue are stimulated by T lymphocytes and endotoxins that make up the mononuclear phagocytic system. They have three stages of recognizable maturation or precursors instead of the 6 stages seen with the granulocytes. Monoblasts and promonocytes are found in very low concentration in normal bone marrow. They are increased in leukemic processes involving that MNP system. Monoblasts cannot be differentiated from the myeloblast in normal bone marrow due to its similar composition. Here we have an image of a monoblast. They're about 12 to 20 microns in size. Their nucleus is ovoid or round and can be folded or indented. They have a pale blue-purple dispersed lacy chromatin with several nucleoli within its nucleus. The cytoplasm has abundant agranular bluish-gray color. A promyelocyte is 12 to 20 microns in size, and it's the first morphologically recognizable cell within the bone marrow. Its nucleus is irregular and indented with a fine chromatin network. The coarser the monoblast, you may see nucleoli at this stage. The cytoplasm has abundant blue-gray color and may have nonspecific granules. They contain a nonspecific esterase, peroxidase, acid phosphatase, and aryl sulfatase. The monocyte is 12 to 20 microns in size, and it's the largest mature cell in the peripheral blood. Its nucleus is frequently horseshoe-shaped or bean-shaped. It has numerous folds like brain-like convolutions, and it has a chromatin that's loose and linear like a lacy pattern. Its cytoplasm is bluish-gray in color, and they have evenly dispersed fine dust-like membrane-bound granules that resemble ground glass. And you also see vacuoles that are frequently present. Now, macrophages, when monocytes leave the peripheral blood and enter tissues, they mature into a macrophage, where you see a progressive enlargement of the cell that can reach 15 to 80 microns in size. Here, the nucleus is round with a reticular, like a net-like appearance, and nucleoli may be present. The cytoplasm is bluish-gray in color with very irregular edges and many vacuoles. Now, they can live for months in tissues, and they normally do not re-enter the peripheral blood. Here you see an image of a macrophage that has numerous vacuoles and also has engulfed cellular debris due to a foreign invasion. Now, the kinetics of the monocyte, including the function, we'll talk first about the bone marrow. Within the bone marrow, there is not a significant storage pool. So the time spent in the bone marrow is approximately 54 hours. They are released within a day after maturation from a promonocyte. Within the peripheral blood, they diapedese into tissue after about 8 hours only. Here they have a marginating and a circulating pool of monocytes. Now, their function is to be active in the innate and the adaptive immune response. They ingest and kill microorganisms. They inhibit growth of intracellular microorganisms by activating soluble products of T lymphocytes. Their killing is nonspecific. They can also be activated by other substances such as endotoxins and naturally occurring opsonins. The monocyte The MNP system has the ability to bind directly to microorganisms. Here the macrophages attack and kill by direct cytotoxic effect. They are also important scavengers. They can phagocytize cellular debris, aging cells, particulate matter, clotting factors, and antigen-antibody complexes. They also remove toxic substances from the blood. They are a very important role in removing aged red blood cells, and they conserve iron. In the spleen, these macrophages remove those cells by coating them with antibody. So another major role in initiating the adaptive immune response is producing antigen-presenting cells, producing cytokines, and stimulating the proliferation and differentiation of lymphocytes through cytokine secretion.